This is HealthyKidneyInc.com. This is our channel here on YouTube. This is Robert Galerowitz, kidney survivor. And today I wrote up a quick diet plan for people with diabetes or anybody with kidney disease who wants to balance their blood sugar better. So generally this is going to be for people with diabetic kidney disease. And when you get that high blood sugar, it damages the kidney. And so some people are really looking to control that blood sugar, which we always want to do. But if you're really looking to focus on controlling the blood sugar, this is a diet which can help control your blood sugar when you have type 2 diabetic kidney disease, and it's also not stressful on the kidneys. It does incorporate some animal products just to make it easier for everybody to follow. We have lots of other videos on our channel. If you're new, subscribe. I'll be coming out with more vegetarian, vegan recipes and diet plans for diabetics. We do have other videos too about that. So let's get into today's sample menu plan for controlling blood sugar with kidney disease, and most people have diabetes. Breakfast. All right, so you're going to start off with an omelet. Okay, so eggs. I did another video about eggs. So you got the egg whites, egg yolks. If you're trying to watch phosphorus, use less egg yolks and more of the egg whites. But if you don't have an issue, feel free to have the whole egg. Maybe a 2-egg omelet, maybe 3, it's all depending on how much you eat, how many calories you're looking to take in per day. Add kidney-friendly vegetables to it, all right? Add some scallions, add some cauliflower. Generally, cauliflower, you would use the heads, the flowering part, to cut that up. You can put it real small, sprinkle it throughout. Some peppers, okay? Peppers are great. Red peppers, green peppers, little mushrooms, onions. All right, just kidney-friendly vegetables loaded up with. Use an oil instead of a butter. You can use butter if no problems with your cholesterol, but use a little oil in your pan to cook it. And so you can start the day with that. If you're looking for something else besides that omelet, you can have a wasa crisp bread, rye wasa crisp bread. Rye doesn't raise blood sugar. And with that rye, you can add like 2 tablespoons of a little bit of low-fat cream cheese. Okay, look for always the lowest salt. You can add 2 tablespoons of hummus. You can add 2 tablespoons of baba ganoush. Okay, baba ganoush is a pureed eggplant. Any of those work. Baba ganoush tastes great. I like them all, but you can use whatever you like there for your breakfast. So that covers breakfast, all right? Maybe you go right to lunch. Maybe you have a snack. For a snack, how about we do a couple cherries, okay? Maybe some berries, maybe an apple with your cherries. All things that won't raise the blood sugar high. But again, if you're diabetic, only you know what's going to affect your blood sugar 100%. These are guidelines which work for majority of people. But as I always say in other videos, test your blood sugar. Okay, so we got that snack there. If you want to use those fruits later in the day, or you want to have them as a snack at that point, that's fine. Going to lunch. Okay, so we're going to do a 1/2 cup of carbohydrates. I brought a 1/2 cup of rice. White rice or brown rice or another whole grain rice. That only depends if you're really monitoring and aggressively trying to get your phosphorus down. If not, go with the whole grains. Okay, it's better for you. And we're keeping it small to a 1/2 cup, which most people should be able to tolerate. From there, you can add about a cup of black beans or maybe garbanzo beans, chickpeas. So that would be your protein. Beans don't raise blood sugar, so you get fiber from it. You get a healthy carb that doesn't raise protein, a complex carbohydrate. From that, maybe you want to have a salad or some other vegetable. It could be raw, it could be cooked. I'm recommending raw with olive oil, extra virgin olive oil added. 1 to 2 cups, 1 to 2 tablespoons. Sorry, don't use cups. 1 to 2 tablespoons added. Now the oil gives you a healthy fat. It's kidney friendly. Doesn't affect blood sugar, gives it some taste. You can add some vinegar, and you can always add fresh spices, seasonings throughout everything. You can also add in like 8 pecans, maybe 8 to 12 pecans, like a 1/4 cup, in with your salad, or maybe just have it on the side and eat it. You can mix it in there with the vegetables, so that could be your lunch. From there, we're going to dinner. So dinner, we're gonna have a piece of salmon, all right? Salmon's like king of the fish. All right, it's super fatty, which gives you all those great omega-3s, and that fat isn't gonna affect cholesterol, that type of fat that's in there. We're looking at 3 to 4 ounces cooked for most people, 3 to 4 ounces cooked. What's 3 to 4 ounces cooked? Generally for most people, it'll be their palm. okay? Maybe a little bigger, a little smaller depending on the size of your hand, but that's after you cook it, you weigh it. You don't weigh it before you cook it. All right, so that's some delicious salmon, okay? Keep the oil light, but enough to cook it out, whatever way you're doing it. From there, I'm gonna say have a half cup of your favorite carbohydrate. If you want pasta with a little marinara sauce, if you want rice, you want little potatoes, you want corn, you want quinoa, you want buckwheat, kasha, whatever it is that you're having, whatever your carbohydrate is. If you want to have one slice of bread, that would be okay. Generally, most people will be okay with just that half a cup, one slice of a bread. It's not enough to raise blood sugar. From there, you always got to go back to having those vegetables, salads, raw, cooked. I love cucumbers. I've been doing a lot of cucumbers lately at dinner. I just cut them up. I put a couple tomatoes, not a lot. The ratio is really a lot more cucumbers to tomatoes. I put some nice healthy extra virgin olive oil on there, some vinegar. I have a Miss Dash salt line. I have other salt-free seasonings, and that could be a big vegetable right there for you. But whatever's cooked, the half cup of carbohydrates, that's dinner. After dinner, if you want a fruit snack, maybe a yogurt, a plant-based yogurt, make sure that plant-based yogurt has a little bit of protein added, or a dairy yogurt would be okay. Maybe go back to that rye wasa crisp bread, and you go back to having some of that hummus. But all this should keep blood sugar very well controlled, and since it's not a lot of animal products, there's a little bit, and we got a lot of other vegetables, fruits in there, and things, and whole grains for the most part. Whole grains, if you have to watch phosphorus, avoid it. But that won't stress the kidney out, keep the blood sugar low, very healthy, good for anybody out there, and it's not an extreme diet any which way where you may have to do big overhauls and changes with your diet. So take a look at the description below. Take a look at our website. We have everything from this video broken down in a transcription, healthykidneyinc.com. To your best kidney health, everybody, from one kidney survivor to another. Bye.